Hello to everyone on the line. We are just going to wait maybe a couple more minutes to see if we get a few more people to join us, and then we'll go ahead and get started. Save the Children and the Institute for Reproductive Health. We're looking forward to spending the next hour meeting and discussing with each of you and learning more about what you'd like to gain from the COP. So before we get started, just a few logistics for those who might not be as familiar with Zoom. You are able to unmute and mute yourselves and should feel free to go ahead and do so when we do introductions and when we have our discussion following the flash presentations. But please make sure you're muted while you're not speaking. And just to let you know that we're recording the webinar. We had some hiccups last time around, so fingers crossed that all will go well this time and we'll be able to share the presentation and recording afterwards. If you have any other questions or technical issues as we go, you can send a little message in the Zoom chat and we will see what we can do to fix it. Okay, so just before we dive in, here's a quick overview of the agenda for today's online meeting. We'll do introductions, and then we'll move right into the flash presentations. We have two presentations, which should be quite brief, on working with parents of VYAs, and we have Shweta Verma from Children International and Nicole Cheetham from Advocates for Youth, who will be presenting on their work with parents of VYAs. Then we'll open the floor for discussion, primarily led by all of you. Whatever you would like to ask about or throw out to the group as a question for discussion, we hope that you will. And then in the last 10 minutes or so, I will present very quickly the results of the engagement survey and just share what you told us you'd like more of and which ways you'd like to continue engaging with the COP. And then, as always, we'll have open mic time, 5 or so minutes, for all of you to share any questions, suggestions, or organizational or event updates relevant to our work on the VYA COP. So without further ado, why don't we move into some member introductions? And I see there's quite a few of us now, so the way we usually do this is to just sort of divide it and say, if your last name starts with A through G, please go ahead and unmute yourself whenever you feel ready, and just tell us your name, your organization, and then briefly 1 to 2 sentences on the work that you're doing with VYAs. Thanks.
Jill Gay, What Works Association, Girls Education in Senegal.
I'm Sophie Baumgartner. I'm from IPPF and I work on a youth and adolescent project.
Hi everyone, this is Amy Eibold with Mercy Corps, and I support a global portfolio where we work with young adolescents.
I also have quite a few countries in my portfolio that have work with VYAs in them.
Oh, I think we may have missed the first part of that introduction. I think, was that Wendy Castro?
It was, yes.
Thanks, Wendy. Okay, if there are no other A through Gs, let's go ahead with the rest of the alphabet.
Hello, my name is Marjorie Macieda. Excuse me, sorry, morning voice. I'm an independent consultant, and I've been supporting the Global Early Adolescent Study in Brazil. They're getting that the instruments adapted for use there. And also I do some local support in my community with groups that work with after school low-income youth. And I've done some sexuality education and mentoring of very young adolescents.
Hello, everyone. My name is Laito Mpofu from Zimbabwe. I'm with Catholic Relief Services, and I'm working with VYA in the specific fields of psychosocial support in Manica Island, which is a post-cyclone Idai area. Yeah.
Hi, everybody.
Hi,
This is
everyone.
Callie Simon. Oh, go ahead.
Sorry, Callie. This is
Go ahead,
Jeannie
Jeannie.
Long. I'm on the school health and nutrition team, and I support 2 projects right now in Mexico that are going to be working or will be working with very young adolescents. And I think one of my colleagues is on the phone, so we're excited to hear about parent engagement.
That's great, Jeannie. And this is Callie Simon, also with Save the Children. I lead our adolescent SRH team. And as Jen and Wendy mentioned, we support a range of VYA programs in a bunch of different countries.
Hi everyone, this is Trisha Petruni from Pathfinder International. I lead our Act With Her project based in Ethiopia, which is a multi-sectoral adolescent empowerment program that includes a cohort of 10 to 13-year-olds, boys and girls.
Hi, everyone. This is Caitlin Thessel from USAID. I work in the Research, Technology, and Utilization Division of the Office of Population and Reproductive Health. And we manage the Passages Project, which focuses on transforming social norms for reproductive health. And we have a big study underneath that project called the Growing Up Great Study in DRC.
Hi everyone, this is Natasha Stevanovic-Fen. I'm a senior researcher at the Institute for Reproductive Health. I work also under Passages, which Caitlin just mentioned, but also do a lot of work on female genital cutting in West and Central Africa, supporting some UNICEF initiatives.
Good morning, my name is Jane Otai. I work with Japaigo. And I'm based in Baltimore, supporting programs in Africa, mainly Kenya, Tanzania, with very young adolescents. And we do a lot of advocacy with government to be able to allow comprehensive sexuality education in schools, but also to inform communities about how they can support the very young adolescents to prevent other pregnancies. We also have included menstruation in our programs for very young adolescents.
Hello everyone, I'm Ishani Ruanpura. I work for UNFPA Bangladesh. We work with very young adolescents, both girls and boys, to provide them with life skills education through schools and clubs, and also to prevent child marriage. Thank you.
Hi everyone. Whoops. Susan Igris here. I don't know who else. So let me just, I'm with the Institute for Reproductive Health and doing consultancies on an occasional basis. I'm the Senior Technical Advisor at IRH and have been involved with VYAs, even predating the work at the Institute and Passages when I was with CARE in Haiti. Have been involved in policy analysis, program evaluation, and most recently with Growing Up Great under the Passages project, working with very young adolescents as evaluators of their programs.
Hello, I'm Crystal Porter with World Relief, and I'm working mostly in the child development and child protection sector with early adolescent kids clubs with a global profile.
Hello all, I am Rudo Kashiri. I work at Save the Children and I am the coordinator for our reproductive health team. So I am in a various different amount of projects working with the VYAs.
Hello everyone, my name is Manika Garg. I work with the Institute for Reproductive Health at Georgetown University, and I work on passages, as Caitlin and Natasha mentioned previously, and I'm excited to be supporting the webinar today. Thank you for joining us.
Hello, everyone. This is Shweta Verma. I work with Children International, and I lead the Adolescent Reproductive Sexual Health for Children International globally.
Okay, I think, Nicole, do you want to go ahead and introduce yourself as well, just real quickly?
Sure. Hi, everyone. This is Nicole Cheetham, and I'm the Director of the International Division at Advocates for Youth.
Thanks. And I think either I missed or we missed Amy Babchek during our first A through G. Go ahead, Amy.
Good morning, everyone. This is Amy Babchek. I am joining this call in my capacity as a consultant, and I'm looking at some work that's been supported by the Gates Foundation. So I'm collaborating with Laura Hahn in her very young adolescent work.
Great, thanks. Is anyone else? I think we heard from everyone. If we did happen to miss you, feel free to go ahead and introduce yourself in the chat box as we move along. And I guess I should say, I'm Jen Gales, and I'm an adolescent sexual and reproductive health specialist at Save the Children. I am supporting implementation of the Growing Up Great study under Passages project, which has been mentioned by others already. And I work with VYAs through sponsorship programming as well in a number of different countries. Great. Okay, well, why don't we jump into our flash presentations? We have two, and the first one will be presented by Shweta Verma, who just introduced herself. I'll say just a word more. Shweta is the global lead for behavior change communication for Children International. She has 19 years of experience in the field of public health with expertise in program management, public and private sector engagement, project design, and technical assistance. And she's worked for USAID, PSI, JHUCCP, and the BBC prior to joining Children International. She's an alumnus of the London School of Hygiene and Tropical Medicine. And today she's going to be talking to us about Children International's recent efforts to create a new program design for work with VYA and their parents. So without further ado, Shweta, I'll turn it over to you, and I am happy on my end to advance slides, so just let me know.
Thank you, Jen. And a very warm welcome to everyone. The topic for today's presentation that I have is real involvement of adolescents and parents in program design using human-centered design process. Before I dive into the presentation, I would like to give a brief overview of Children International. Children International is an international nonprofit organization operating in 11 countries in Asia, Africa, and Latin America. Our focus areas are health, education, empowerment, and employment. We work with around 200,000 children and youth globally in urban slums from the age of 3 till they turn 24. CI's, thank you. So CI's Adolescent Health Program, we have been implementing since 2010 with focus on adolescent reproductive sexual health and substance abuse. And this was based on an in-house design curriculum basis the global best practices around, which was designed around 2009-10.
what we identified, and since we had been implementing this for the past 10 years, basis brainstorm with our country teams, we felt that the curriculum or the program, it provided what to do, but it does not focuses on how to do it. So it was knowledge focused and content heavy. The other key piece that we were feeling was that we didn't had an age segregation in our program. So one program was reaching out to youth in the age group from 12 to 19 years. And we didn't had a parent engagement component. So there was a felt need to make the program relevant to today's youth, looking at their media exposure, targeted messaging, creating relatability, and also making it interactive. So in 2018, CI, in partnership with Institute for Reproductive Health, went through a program redesign process. And I'm glad that Susan is on the call as well today. Next slide, please. Today, I'm going to take you through the program redesign process that we had. And from the concept itself, human-centered design was at the heart of the entire program design process. Even before the process started, we did 2 rounds of intensive brainstorm with the in-country health teams across 11 countries where we work to ensure that we get their experiences captured, followed by a thorough review of the existing program curriculum. And this was done essentially to ensure that we do not lose out on our field experiences in learning. And this also provided inputs for our formative assessment design. And I will touch upon the various components throughout the presentation. Next slide, please. So we did a formative assessment with very young adolescents, 10 to 14 years, older adolescents, 15 to 19 years, and with parents and caregivers. We did it in urban slums of Lusaka, Manila, and San Pedro Sula because we have presence in the 3 regions. 425 participants participated throughout the formative assessment process. And we used a number of participatory tools and methodologies such as open-ended stories, healthy relationship web, gender pile sort, problem wall and solution tree, brainstorming session with parents. All the tools were adapted to the country context and were pre-tested with the audiences before implementation. The objective of the formative assessment from the youth was to learn about the social pressures, identify sources of advice and counsel, understand the interpersonal and institutional support, and assess their life skills. For parents, it was to learn about their concerns, fears, and hopes for their adolescents in relation to safe sex and substance abuse, identify sources of advice and counsel, understand the interpersonal and institutional support, and also assess their life skills. In addition to this, which was where we conducted the primary research, IRH team helped us review and compile global best practices from 20 plus curriculum that were getting used for VYAs, OAs, and parents. Next slide, please. Once we had the findings from the formative research and the 20 plus curriculum review process, we did an intensive 6-day co-creation curriculum design workshop, which involved staff from 3 countries representing the 3 regions where we work, and with youth and parents. The youth and parents were consulted in real time throughout the process of theme selection, session outline, and the content was vetted with them. And once we finished the process, we also pre-tested the entire curriculum. And you could see some of the pictures on your slide. right now. So there are meetings starting from left on the slide. We are doing consultation sessions with the older adolescents, then VYAs. We are discussing the content with the parents. There were some activity finalization discussions with the parents. And the last picture is of the core team, which worked on putting the curriculum together. Next slide, please. The next two slides, I will focus on the highlights of our very young adolescent curriculum and the parent curriculum. We also have older adolescent curriculum, but since the theme today is VYAs and parents, I have not included the older adolescents. Next slide, please. For the very young adolescents, we have got 7 sessions listed on the left side, which are linked to the critical life skills that we want them to practice. And just going back to my first slide where I said that we told them what to do, but they didn't know how to do it. So these curriculums focus a lot on building life skills around adolescent reproductive sexual health and substance abuse. And in addition to the life skills, all these life skills have been inculcated in a way which is highly participatory. So the whole curriculum is activity-based. And each session is broken down into smaller activities. As all of us who work with adolescents or youth, we know that their time is a critical factor in participation. So each session can be divided into smaller activities if need be, depending on the availability of the youth for that session. And one of the other key pieces that we have focused on is that for absorption of the key messages and take action, there is a simple doable action as a home assignment for them. So once they do one session, they come back for the second one, there is a simple doable action that they have to do. And then we start the second session kind of reflecting on that simple doable action. This helps us understand the absorption and the action taken piece. Next slide, please. Similarly, for the parents sessions as well, we have got 5 sessions for parents, again focusing on the critical life skills that they need to build on to be able to have to contribute to the adolescent reproductive sexual health and substance abuse with their adolescents. And again, activities are based on reflection and sharing, a lot of interactive games, group discussions, role plays, and a lot of audiovisual materials to keep them engaged throughout the process. Next slide, please. In addition to the co-creation of the curriculums, we also did an intensive workshop to co-create the monitoring, learning, and evaluation. What I'm going to share with you today is the learning component from the MLE. As we are implementing these curriculum in 11 locations globally, we decided to keep 2019 as a learning year for the organization. And we have designed tools for systematized learning and documentation. We designed tools such as program monitoring tool, facilitator reflection guide, and the learning template to document the learning. The key learning questions that we want to focus on during this year is how comfortable are the program staff to facilitate different topics and which topics are challenging. Were the curricula implemented in a participatory experiential way as reflected in the session plans? What sessions worked, did not work well, and why? Which sessions, activities do participants like or not like, and why? And were any sessions adapted due to cultural age or other sensitivities? Which ones and why? The learning templates will be used to have dialogue with each country team in the beginning of next year. And the program will be further contextualized in 2020 to each country context. In addition to this, we are using the current year to finalize the indicators for the program and also working on the evaluation tool, and which primarily will be participatory tool so that we can get impact evaluation done with VYAs and parents in less literate settings and in a manner where they feel part of the process. And we are also working on this through a working group with our country teams, and we will also pre-test the evaluation tool with the parents and the VYAs. Next slide, please. As we did this year-long process of program design, some of the missing links for us from a VYA and parents perspective that we identified are lack of interactive curriculum for parents. We also could not find a lot of program content on substance abuse, despite we did a very thorough literature review. Lack of interactive videos and games for parents and or VYAs. As we are in the process of currently looking at evaluation tools for parents, we are finding it hard to find published evaluation tools for parents, and especially tools which link to life skills for parents. And also life skills linked indicators or tools for adolescent reproductive sexual health and substance abuse in general. So, yeah. And that's my presentation for you. Happy to take any questions later. Thank you for patient hearing.
Thank you, Shweta. I'm sure it wasn't easy to boil down a year-long process into a brief presentation. I know we have a couple of questions already in the chat box. We are noting them, but I think we will move right on to our next presentation, and then we'll take all questions as part of the discussion section after the presentations.
Okay, okay.
Thanks, Shweta. So our next presenter is Nicole Cheetham. She is the Director of International Youth Health and Rights at Advocates for Youth. She has over 20 years of experience working in international public health and provides technical assistance and training on a broad range of strategies to support partner organizations. She also oversees international efforts for the AMAZE initiative, a consortium which delivers sexuality education to VYAs and their parents through short animated films. And that's what she will be presenting to us today.
Great, thanks, Jen. Hi, everyone again. So I am going to be zooming in on one initiative that Advocates for Youth is currently undertaking along with other partner organizations. But just to say first that Advocates for Youth is a nonprofit based in DC that works domestically and internationally to advance youth sexual reproductive health and rights. And much of our work and our programming has involved strategies to encourage parent-child communication and foster parent-child communication within broader programming domestically, internationally. But today I'm going to be just zooming in on the AMAZE initiative. So next slide, please. Oh, great. Okay, so AMAZE is a collaboration between Advocates for Youth, Answer, and Youth Tech Health, as well as local partner organizations in different parts of the world. So it's kind of a mix of sexuality education expert organizations and technology. Next slide, please. And what AMAZE seeks to do, our hashtag is more info, less weird, is really to take the awkward out of sex ed for very young adolescents in particular, but also for parents and teachers using short animated videos. And It's a free online resource, so it doesn't cost anything to access. And currently the inventory of short animated films is at about 90, and they're published on YouTube. And so they're age appropriate, medically accurate, engaging, and funny. Slide, please. We started AMAZE, just seeing that there seemed to be a gap in sexuality education resources for very young adolescents that was age appropriate, but also fun and affirming. You know, coupled with that, this sort of growing emergence of access to technology. Next slide, please. So AMAZE was launched in 2016 in the US, and it's a YouTube-based platform primarily as it relates to very young adolescents, and then it also has a website that caters more to educators and parents, in addition to some other platforms. So just to give a sense of, on the metrics at the moment, for YouTube, AMAZE currently has like 28 million views and 125,000 subscribers. So that's where we are today after launching in 2016. We have found that Facebook is the platform of preference for parents domestically in the US, but also in Latin America and the Caribbean and in East and Southern Africa so far. Domestically in the US, there's about 9.5 followers. The work internationally has been growing, and advocates are spearheading that work with partners. So we launched in South Africa in 2017 and in Mexico in 2018. We're working with IPPF Western Hemisphere region for the regional initiative in Latin America and the Caribbean, with UNFPA East and Southern Africa regional office for the initiative in that region, along with some other partners. TV Smiths is a video production company in South Africa, and then many NGOs that reach out to us from countries around the world, but most prominently currently Pilcon in Japan and Aosung in South Korea, among others who we're working with to sort of adapt, broaden, dub AMAZE videos. Slide, please. Thank you. In terms of the topics, much like was just discussed, you know, it's comprehensive sexuality education covering a broad range of topics. This is grounded in standards. So the AMAZE videos cover puberty, healthy relationships, personal safety, including consent, sexual assault, bullying. We also have sexting and cybersecurity videos within that category. There's pregnancy and reproduction, STIs and HIV, sexual orientation and gender identity. And again, so grounded in guidance, but also in gender equality and rights. And they're very intentionally developed by sexuality education experts working in collaboration with partners and production and artists, you know, artists, video production companies and animators. Next slide, please. Thanks. So in terms of the parents, like I said, we were really seeking to provide sexuality education that could be directly accessed by very young adolescents who are already on technology and using technology. But in addition, we of course have developed materials for parents and educators, and know that, you know, parents generally want what's best for their children. They do want to be able to talk to their children about issues about growing up and sexual and reproductive health, but as we know, often feel uncomfortable or are lacking the knowledge or the right words or the right ways to broach these topics with their children. So so as a result, in terms of the resources that AMAZE provides parents, I think, yeah, there's a few. So, and these are, a lot of them are, these are mostly housed on the website, again, knowing that adults are using websites, unlike very young adolescents that are not. So having the talks is one section that provides background information related to videos on 6 overarching themes, and we'll see a clip of one of those at the end of the session of the presentation if there's time. But for example, those topics currently are relationships, porn, bullying, masturbation, girls in puberty and boys in puberty. In addition, we have talking tips. So this goes back to some of the work that we've done previously with just basic tips for talking to your children about sexuality and growing up. and then conversation starters and key messages that accompany these videos that are developed for parents that include sample language. And, you know, again, going back to some curriculum that we had developed in previous years, we know that parents often really just struggle with the words. So we're trying to model, you know, provide some videos to sort of brief parents on how to start that conversation, but then also provide key messages that parents can refer to and actual language to give them words to start to have some of the conversations that are challenging. And then this little ta-da blue thing announces that by the way, a new initiative, although not for very young adolescents, but for younger children, we've launched AMAZE Junior, which is specifically for videos for parents to watch with their children ages 4 to 9 that answer typical questions that come up developmentally during that age range. That's another issue, another initiative. So this is just an example of the website, this next one, just so you have a sense of what it looks like, just the website for parents. And you'll see that there's an age guide that provides parents with guidance on which videos are for which ages, and then having the talks or the videos where we're sort of helping parents prompt them for those conversations. And then there's the junior, AMAZE Junior, which is for the younger children. And the next slide, like I mentioned before, sorry, Facebook seems to be the place to be for parents these days, interestingly, as it started out to be, you know, as the space for young people. So we do reach a lot of parents this way, and this is just the front page of our AMAZE parents for the US, and there is one for Latin America and the Caribbean that IPPF Western Hemisphere region is running, and then there's another one also for East and Southern Africa, run by the TV Smiths. The next slide is just another resource. This comes out of Latin America, so they also do a newsletter, as we do domestically in the US, which are very, you know, just very brief, literally not much longer than this, where we do announce a new video. So parents are totally on top of that when the new stuff comes out, and any other resources and updates that they might be interested in. And I think with that, I'll just, if we have time, we can show one quick clip of one of the Having the Talks video. This is Lucinda Holt from Answer, one of the core partners of the AMAZE initiative, talking about girls' puberty.
Actually, Nicole, I think if it's all right with you, for the sake of time,
sure,
maybe we could move into discussion now.
Yeah, no, that's fine, no problem.
But I did watch this video, and I highly recommend it. Okay, and I think this is just your closing slide.
Contact and the URLs if you're interested, yeah.
Okay. Great. Okay, thank you so much, Nicole, and thanks again, Shweta. We do already have a few questions, and I'm going to go ahead and just read out some of the questions that were posed in the chat box, and then others, please feel free to add your questions in the chat box or just unmute as we move along through the discussion. So some of the first questions were for Shweta about the curriculum. I'll read you a couple maybe, and you can respond to all of them, or just take a few. So someone asked, what insights does the learning to date provide about how well the curriculum is working? I think relatedly, what were the elements of promoting communication with children? You talked about building skills. How did you address the need to link up parents and children and get them talking? And then another question about how you got parents to commit to participating in all the sessions instead of selectively, or maybe according to their schedule. So we'll leave it there for a first group of questions, and we can ask a second group later.
Okay, thanks, Jen. So I will start with the participation question. And as I said in my introduction, CI works in these communities for a very, very long period of time. So we work with children, they enroll with us when they're 3, and they go out of our program when they're 24. So we have a really large window where we work with these children when they turn into VYAs, OAs, and then they kind of graduate out of our program. So there is a rapport which is there with the communities where we work. So that makes it kind of, we have that rapport with the community and the parents and the kids, that they know us and we know them, one. But having said that, the time availability of the parents is always a challenge, because most of them are either daily wage earners or they have to travel far for work. So that's where the one critical piece that while designing the curriculum, we decided to keep the sessions which can be broken into smaller chunks. So if a total session is for, say, 1.5 hours, we can break that down basis each of the activity. Depending on the availability of the time that the parents have, we have the flexibility within the curriculum to adjust it. So maybe instead of the 5 activities which comprises a session, we just do 2, but do it well, and then we kind of engage with them subsequently. That's one piece that we are learning. And in terms of interaction with parents, it's meaning all these sessions, although pre-tested and vetted with the parents in real time, it's taking much longer to do the interactive sessions than what we have anticipated. And so what we are doing is that throughout this year, we are kind of implementing this curriculum and taking notes and answering some of those learning questions for ourselves. But time is a critical factor because of the literacy piece and also the availability of the parents. But they are enjoying it, is what I have heard continuously, although time is a constraint. So I have heard great feedback from across the 3 regions on the curriculum so far. Jen, did I capture everything? Or did I leave out?
I think. Thank you.
Okay, thanks.
Do others want to jump in with follow-up questions? Otherwise, I see there are some questions in the chat box for Nicole. Okay, I'll go ahead with the questions in the chat box then about AMAZE. So first of all, you have someone who thanked you. She's shared the videos with her sister for her 11-year-old nephew. So a big thanks to you. Someone else asked if the AMAZE videos have a sequence. And then another question is if you're tracking any outcome measures related to parent-child communication.
Yeah, and I think there was one too about whether they're whether we make contextualized videos as well, or if we change them for certain different contexts. So should I just answer all of them real quick?
Sure, go ahead.
Okay, yeah, no, so maybe starting with that one. So our partners in country, yeah, there's different levels of adaptation of AMAZE videos. Some groups contact us seeking to want to just subtitle videos into their local language. Another level is dubbing, where you're literally just voicing over in local language. And then another level is adaptation, where you're actually making changes to script and as well as visuals and or music to adapt it, what you're seeing and hearing more to the local context. And the regional initiatives are adapting videos and also creating new videos from within the region. So in East and Southern Africa, for example, there's one that was created locally on HIV disclosure. In Latin America, there's one that was created specifically for boys' puberty from within the region. And it depends, this is all very decentralized, and we're basically responding to inquiries from groups, organizations that are wanting to use the videos. And in just one more thing on that note. So, and in Latin America, for example, Uruguay has taken it to even another level where they've added sign language within the videos, because they're working collaboratively with the Ministry of Education to use the AMAZE videos there in collaboration with the support of IPPF Western Hemisphere region. So it's very flexible, and AMAZE provides all of the access to the content so that our partners can work with that and make changes. In terms of the sequencing, there is no particular sequence. So at the moment, it's becoming actually an issue, because with 90 or so videos, that's a very large inventory. And even within the categories of topics that I mentioned, it's hard to get a grasp of the totality of everything. So we're working on some system to make that a little bit more manageable, but there is no particular sequence. People are really picking and choosing, and school districts are picking and choosing. Countries are kind of picking and choosing which videos they want to show to whom and in what way. And tracking outcome measures related to parent-child communication, we are not tracking that at the moment. We have done a small evaluation just to get a sense of impact of the videos themselves on very young adolescents, but not, we haven't done anything specifically around the impact of, of increasing parent-child communication. That's wrong. I think I got it. Let me know if I didn't answer something.
Okay, thanks, Nicole.
Sure.
Is there anybody else who has a question that wasn't entered in the chat box that they'd like to ask? Oh. Okay. I did see a couple more in the chat box. Then there's one question about how you're thinking about inclusion and working with populations who might be living with disabilities or other marginalized or vulnerable groups. And there's also a question about French resources, French language resources.
Yes, so we are sort of exploring a more intentional strategy around adolescents with disabilities. We currently feature adolescents with disabilities in videos, and we have one specifically on adolescents with disabilities, but we are actually looking into the possibility of creating a parallel AMAZE for young people with learning disabilities. So there's two things. There's one which is normalizing and countering stigma of adolescents with disabilities within videos, which we're trying to do and have some, again, our videos are inclusive, but we also are looking into the possibility of developing videos specifically for adolescents with learning disabilities. And in terms of French, I would wish we had more in French. We're not currently working with a Francophone African country or a partner in a Francophone African country or a French-speaking country, Caribbean otherwise. But we have 10 videos that are just subtitled in French. So that's just what we have at the moment. But we're, very certainly interested in expanding that when we have partners, reach out that are interested in doing that.
Okay. I think we have time for just one more question, and I see Marjorie has written in the chat box asking if it's been an issue to deal with LGBTQ issues among parents in the countries that you're working in.
Jen, I can respond to this on the program that we are implementing right now. We do have the gender piece highlighted across all our 3 curriculum, and even in the parent curriculum, we do bring in the topic of gender and how it gets talked about, and it does touches on the LGBTQ. Although not much in depth, but just normalizing the different genders. And I have not heard anything back so far, and we have been in now 4 months 4+ months of implementation, meaning nothing objectionable has come to me so far.
Okay, so no social pushback. That's good.
Yeah, haven't heard anything.
Okay. Okay. Well, I think we'll move on now so that we have time to share the results of our poll. But I want to really thank both of our speakers for taking the time to share about your programs with us, and thanks to everyone who wrote questions in the chat box for a really good discussion. If you have additional questions, you can send them via the VYA COP Google group. You can send them to me. You can send them directly to our speakers. We really want to keep the conversation going. So please don't be shy to reach out with additional questions as they come to you. So I wanted to just take a few minutes to present the results of the engagement survey, which was originally circulated a little bit over a month ago. It was very brief, 4 questions, just meant to help us get at what topical or thematic area is most important to our membership, which topic for discussion is highest priority for the next quarterly online meeting, and then if there are other ways you would like to engage with members of the COP. So we had 26 responses, which I think is pretty good, since that's exactly how many people we have on the call. And so here is the results very briefly. So in terms of preferred thematic area, they were grouped and respondents were allowed to select several. So you can see we're over 26 here, and the most popular, which I think are very much in line with how we've approached this COP, are sexual and reproductive health and gender, and then SGBV sort of coming up third. Life skills and economic empowerment are also of interest, and then health in general and HIV/AIDS maybe a little bit less. There were also some write-ins related to social norms, comprehensive sex ed, abortion. Someone noted that communicable disease is one of the top killers of adolescents in this age group, and so maybe we should be thinking more about that. And then linkages. So I don't think any major changes from this, but just so that you can all see what your colleagues were sharing. The next question was about future topics, and as you can see, I think the topic that's of greatest interest, which came up at our last online meeting, is this idea of what is developmentally appropriate content and approaches for VYAs. What does that mean, developmentally appropriate? And particularly digging a little bit deeper into what some of the most recent brain science is telling us about appropriate content and approaches. So that will likely try and put that forward as the topic for our next quarterly meeting. And you can see the others were around accessing and advocating for age disaggregated data. That's long been a topic that we've tossed around. And then evidence from domestic work with VYAs and ethics of research and programming with VYAs of some interest as well. The last question was about how else you might like to engage. And I'll say we don't have any immediate plans for any of these, but it's helpful for us to orient our thinking about what we could do. A lot of you are looking for collaboration with other members, potentially for some joint submissions, which was another popular response. About 20% of you were interested in in-person meetings. I think the majority of our membership is based in Washington, D.C., although I know we have colleagues today who are joining us from all around the world. So we'd have to think some more about that. And then it looks like about 8% of you each would love to see some trainings, and 8% of you say online meetings are sufficient. So just wanted to make sure we shared back the outcomes of that quick poll with you and let you know that we will be using that to inform how we're organizing events moving forward. So again, if any of you have additional feedback, comments that you'd like to share, please do reach out. It's not too late if you didn't respond to the engagement survey. So with that, I know we just have a few minutes left, but I want to open the mic for all of you. If there are any additional questions, suggestions for us, or organizational updates, event opportunities you'd like to share, please go ahead and unmute yourself. Okay, I guess not. And if there's no announcements or questions, we can go ahead and wrap up 2 minutes early. We'll give you two minutes of your day back. Thanks to everyone for joining us today. It was a great discussion, and I think we're good to go with the recording. So look for a follow-up email from us soon with the presentations and recording. Okay.